So this is kind of challenge their stabilizers and their endurance of all those muscles there. So he's going nice and slow. We'll have go 30 one way, 30 the other way. They're staying up nice and tall. And this one you can even set a timer to if the patient's going crazy fast. It's 30 one way, 30 the other way. And then we'll also demonstrate abduction. So that was kind of flexion towards the wall, and then we'll face that way. So just a different direction, same thing, 30 clockwise, 30 counterclockwise. And the arm is straight, straight with the body there. Next exercise, S31, we added just a basic push-up. These can be formed in different ways. We have a push-up from the wall. So just in a comfortable position, the feet can be together or apart. You can do an elevated push-up. Just make sure the body's in a straight line, the hips aren't up in the air. You can also do a push-up on the ground. From the knees would be a way to make that a little easier, and then from the feet. Just make sure it's good posture, the hips aren't coming up at all. You can also do a push-up from the ball. And the further away from the ball you are, the harder it gets. If your feet are together, that can even make it a little tougher also. Next exercise, we use the ball again for, these are the Physio-Ball prone tees. This one we're going to add some weight to. I'll hold the ball here for you. So this one, the ball will be in between his chest area. Again, he's using his toes for balance there. We call these tees. Arms are straight. He's just really pinching between the shoulder blades. Make it harder. He's out on his toes. He was on his knees there. Feet together if you want to make it pretty tough. Just challenges the core a little bit more. Really squeeze for a second or so and do that motion there. Next, we have internal and external rotation. This will be with the elbow up at 90. Alright, so the band will be tied behind them to the column. Usually we keep it about shoulder level is where you would tie the band off. He's got the TheraBand comes up at an angle. You notice his good posture, 90 degrees there. He's going to start there and then just come where the elbow is straight. And that's internal rotation. If he wants, he can just leave that band on the same arm, flip all the way around. So he'll start with the arm down straight and then come back up to 90 there. So that's internal and external rotation of the right arm. Good. Next we have the D1 flexion extension. D1 is kind of like the feeding motion. So if the right arm's the affected, you kind of step on with the right foot. He's basically, the palm is open. You're going to bring the thumb and close the fist up towards, palm that way. Yeah, palm's facing towards the back of you. You're going to bring it up and open that fist right up next to you. So you really contract that bicep muscle there, give you some pec and shoulder involvement there also. So that's D1 flexion, which is kind of like the feeding motion. Like you're kind of putting a spoon in your mouth. That's kind of how you kind of teach that. Next we have D2 flexion, which is S35. If the left arm is the affected, you would stand on the opposite, you put the band on the opposite foot. So he's pulling from this side, palms facing towards your pocket like you're pulling a sword out. And you're going to open up the palm. So he's pulling the sword from the pocket, he's going to open the palm at the top. This is known as D2 flexion extension. Nice and slow, so you kind of have to resist the band both ways. Good posture, he's standing up nice and tall like he is. And that's D2 flexion extension. That's kind of the pulling the sword out of the pocket motion. Next is the shoulder press on the Physio-Ball. And this one we'll just kind of we'll grab some weights for. The ball just kind of challenges your core a little bit. It's a good posture on the ball. Just got his weights up. We're just going to kind of push the weights towards the ceiling. You notice his palms are open, they're not closing in or anything like that. good breathing through this exercise. And that's the shoulder press on the physio ball there. And the last one is S37, which is the lat pullover with weight. And again, the lats are right here. It's that big muscle that comes off to your side. So again, he walked himself out on the ball. If you notice how he did that, kind of demonstrate. Have the patient just sit on the ball, walk herself out on the feet. So the ball, his head's kind of rested on the ball there. The ball's in between his shoulder blades also. The weight is strictly right above his face there. His hand position, notice that. The weight's kind of sitting up in his palms. And he's just going to let that slowly fall back, about even with the forehead. And he's just going to raise it strictly perpendicular to the ceiling there. If he goes past that, gravity kind of helps, so we teach just go straight perpendicular with the ceiling. And really, when you get to the top, this is the muscle right here we're working. He's going to contract that as he pulls up. And that's the physio ball lat pull over. And that concludes phase 3 of the shoulder.